Thank you.
Thank you. We'll now proceed to the question and answer session. On February 29th, every Republican member of this committee sent you a letter asking what your department is doing to address the impact of the illegal immigrant crisis on our healthcare system. This influx of illegal immigrants has forced safety net hospitals like Denver Health in Colorado to turn away patients and reduce the number of beds reserved for Denver residents seeking substance use disorder and mental health treatments. What is your department doing to address this growing crisis, given the real fear that other hospitals in sanctuary cities across the country may similarly be impacted, harming the nation's healthcare system, safety net, and threatening healthcare access for vulnerable patients?
Mr. Chairman, thank you for the question. As you know, we have some of the most advanced and capable hospitals in the world. We count on them to be able to keep Americans healthy and safe. We continue to work with them day in, day out. When Change Healthcare had this cyber attack, we were there to support them as well. We will do everything we can to make sure they continue to provide the services that Americans count on, whether it was during COVID or whether it is now. We're prepared to work with every one of our hospital facilities to make sure that they continue to operate and provide the services that Americans count on.
Has your department been working with Denver Health in Colorado with the issues that I just raised?
We've certainly been working with the state of Colorado. And if we were to get a particular request from a particular facility, we would certainly then try to work with them to resolve any issues they might have.
Earlier this month, the committee passed legislation introduced by Representative Fischbach to block the implementation of the unworkable one-size-fits-all nursing home staffing mandate. Estimates show this rule will impose a $40.6 billion cost on nursing homes, 94% of which currently wouldn't be in compliance, jeopardizing access to care for 1.2 million Americans. Can you commit to the Medicare beneficiaries watching this hearing that no nursing home will close and patients won't lose access to care as a result of this rule?
Mr. Chairman, I can commit to you, and I commit to each and every one of the Medicare beneficiaries that is out there, that if they need a nursing home, they will find one that offers them quality care. We want to make sure that no nursing home becomes a death sentence for any American who has to use the facility. And we want to work with every nursing home to make sure that they are offering quality services. And if you think about it, of the 1,200,000 or so Americans, 1,500,000 Americans who reside in nursing homes, that is a fraction, a little bit more than 1% of, not even 1% of the population. But when you take a look at the death numbers that occurred during COVID, and you realize that 1 of every 5 Americans who died from COVID died in a nursing home, something's going on. And we can't just close our eyes to it. We have to make sure that if we're going to leave our loved one in a nursing home, there is a nurse that's available to provide care. And these standards simply say that. Make sure that if you're going to claim that you're a nursing home, you have the professionals who can provide the services to our loved ones before we leave them there in your care.
So San Francisco recently enacted a law requiring residents who are suspected of using illegal drugs to undergo treatment as a condition to receive welfare benefits. Since 2011, my home state of Missouri has required certain TANF recipients to be screened for illegal drug use, a law that I helped advance at the time as a member of the State General Assembly. And as it relates to the rise in opioid abuse, you yourself have said all options should be on the table when it comes to how communities across the country address the drug crisis. Given that TANF has an outright ban on providing assistance to those with drug-related felony convictions, I appreciate your position, which many of us have believed for a long time, that states should be looking at how to utilize drug testing in their welfare programs. If San Francisco's actions are suitable, then surely other cities, counties, and states should be encouraged to make similar decisions. And so to that end, and consistent with your recent comments, is it fair to say you're open to Congress and states putting stronger protections in place to make sure recipients of welfare benefits are being screened or tested for drug use?
Chairman, thank you for the question. I want to make sure, please do not misinterpret what I said when I referenced the drug crisis, the overdose crisis that we face in this country. Certainly, we want to make sure we are exploring every opportunity to save a life when it comes to the overdose crisis that we face. What decisions a local community decides to make for itself and how it will handle TANF dollars, which is different from specifically dealing with the overdose crisis. I won't pass judgment there. I don't represent that area. I don't have jurisdiction on those issues. But what I will tell you is that any community, whether it is San Francisco or whether it is your district, Mr. Chairman, we are ready at HHS to try to help address the overdose crisis, because no American should die simply because of fentanyl and these other drugs that are now infecting our communities.
Thank you, Secretary.